Hi Todd, my name's Claire and I'm a child life specialist here at the hospital. I hear you need some fluids today but don't really feel like drinking any. Well, I am like a teacher here at the hospital and I'm here to tell you all about the IV start that we're going to have to do here so that you can get all those fluids you don't want to drink. So have you ever had an IV or do you know what an IV is? It means into your veins. So an IV is a special bendy straw that the doctor or nurse is going to put into your veins to help you get some fluids or some medicine. So do you know what your veins are? If you squeeze your fist really tight, you can maybe see right here in your elbow or in your wrist some tiny blue lines. And those tiny blue lines are your veins. And do you know what your veins do? They help carry blood and oxygen all over your body. So if the nurses or the doctor put some fluids into one of your veins here, then those fluids are going to go to the rest of your body as well. So this is Peter, and Peter's going to help us learn about IVs today. So Peter's going to get an IV also, and while Peter's getting his IV, I'm going to show you what an IV looks like so you can maybe feel more prepared. So the first thing they do is they put this tight, stretchy rubber band on your arm. And they do this because when it's really tight up here, it makes all the blood go down here into your hand, and it makes your veins look bigger and darker and easier to see for the nurses and the doctors. Then they're going to take this special soap right here that looks like a stick figure, and they're going to clean off your hand. So this soap right here makes a little clicky noise, and then all the soap is going to come out of this spongy area. And they'll take it and they'll clean your hand or your arm wherever they're going to do the poke. And then the nurse will take the poke, this is the poke, and they're going to say 1, 2, 3, poke. And they're going to put the poke in, but guess what? The poke comes out after. And all that stays in is this little bendy straw. And so the straw stays in, and the nurse will put a piece of tape or a Band-Aid on your hand to make sure that the straw stays in and they can give you all of your fluids. So this is an example of one of the Band-Aids that they'll put on. This one's really big and way too big for Peter, but they'll put a little band to make sure that the IV stays in. And then the nurse will take off this rubber band and you'll be all done. You did an awesome job. Do you have any questions?